Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
Hello, I'm Andrew Weston, and welcome back to Hump Day Health Talk. This time, we're doing something a little different. You're coming with me on my annual visit with our Chief Medical Officer, Dr. Luther Walls. I'm excited, nervous, and I feel a little bit, just a tad bit, like invaded upon, but here we are.
Okay.
Right? It was my idea, I guess, right?
It was.
Here we go. So, I'm going to back up and let you tell me what I need to do.
All right. Sounds good. I have a method of the way I approach every new patient, every annual visit type of patient. I'm pretending you're a new patient for today. So first thing's important for me is to know what brought you in. Because at the end of the day, people usually have something, especially if they haven't seen a doctor in a while, that they're coming in to get addressed. And if I don't address that, no matter how many of the other things I talk about, they're not gonna feel like I did a good job.
So me, I interview to establish primary care. Basically, I don't have any like major concerns.
Okay.
All right.
Perfect. When's the last time you saw a doctor?
The last time I saw the doctor was probably what month is this? It's been about 8 months.
Okay.
Yeah.
Any concerns at that last visit that weren't addressed?
No, I was on some medications that I can talk to you about. But other than that, no.
Okay. Well, my first question would be to you is, who do you talk to about those concerns?
Well, I'm seeing a therapist currently, and so we meet bi-weekly, and so I'm pretty consistent with that. Do have some challenges that he's helped me navigate, but overall, I think it's important to talk to you from a clinical perspective as well.
One thing that we would talk about in a visit as a supplement to therapy is if there's any interest or if you all have talked about what medication might be helpful to manage your ongoing symptoms and concerns. Um, Related to that, we'll also do some screeners related to specifically anxiety, depression. And if there's other things that come up, even sometimes related to PTSD, those are times we can do screenings. For me, it's a great time to start the conversation because a lot of people, until you ask them, they're not thinking about it or realizing they're not talking to anyone about it. And there are some things that I know as a provider from personal experience, from professional experience about ways we can talk about how we're managing with stress or coping. But I also know that sometimes you really just need to engage with professional help. And that can look at a lot of different ways. I like to partner with our behavioral health team here at Care Alliance, and that me getting some of this information really helps me tell them, hey, this is what this person is seeking for, and this is how you can help them out. And then we're in constant communication about when they see me, what updates are happening, and then when they're seeing them, what updates are happening. So we're coming up with a good integrated care plan.
I love that thought though, just the idea of like being able to go to either place inside the building and you all are still having that wraparound care for us. Good, great.
And the thing I tell patients as well is that, it's seeing a therapist, there's lots of reasons to see it. Yes, for some mental concerns like anxiety, depression, or PTSD. But a lot of people don't realize that therapists, and especially our therapists here, are trained to talk about substance use, even things related to quitting smoking. A lot of people want to quit smoking, but we always don't do a great job in the healthcare world of addressing what the barriers are to quitting. And a lot of that is related to stress. A lot of that is related to mental health. We will talk about here's this medication or here's this patch, this lozenge, but smoking is a lot more in depth than that. It's the dependence from nicotine. It's the physical. I'm used to just picking this up and doing that. There is the behavioral side of it. There's even the social side of it. If I like to smoke when I'm with my friends, and so or my family, we smoke together. There's lots of things that we have to think about with address the whole person, and if we're not getting that information, a lot of times we might get them down to a lower number, but if the goal is zero, we have to really hit all fronts of that, and that's where it's really grateful. I'm really grateful to be able to partner with our behavioral health team to do that. From kind of talking about our behavioral health screenings, from there, I will also cover dental, which is a great service that we have here at Care Alliance. But I know a lot of people, they might like, okay, I'll engage with the doctor. But when I ask that question, when's the last time you've seen a dentist? And a lot of times people's first reaction is, oh, doc, I don't know. And that's one thing is that we don't realize that our oral health screenings are incredibly important. They're screening for cancer, they're screening for cavities, There's even sexual health that can be part of those type of screenings. So it's really, really, really important that we're emphasizing those things, especially for people who are at higher risk for complications, whether that's our folks who are smoking or that's our folks who have who are immunocompromised, that's folks who have had certain surgeries. And so it's really, really, really important that we are addressing the whole person really from head to toe in their annual visit so that they know kind of what steps need to be taken to treat the whole person. And that's the goal here. The goal here is for us to take a moment to step back from everything that's going on in the world to say what's going on with you and how can we make you healthier and reach your goals and how you want to maneuver through the world in your day-to-day life. So that's usually our first part of the visit, and then we kind of will do our physical after that.
Okay, great. Well, I'm just like personally, I know it's Men's Health Month, and so I'm like, this is a good time for me to get back on the on the saddle, so to speak. And so I'm glad that we're doing this. All right, I'm ready for whatever comes next. Thank you for all the information.
Of course. Would you like to have a seat over there for me?
Sure.